Good morning once again. I'm Devon Hawkins, a PGY3 at Eisenhower, and I'll be discussing mechanisms of diabetic remission following sleeve gastrectomy, specifically looking at increased LCL-mediated incretin response, insulin release, as well as insulin sensitivity. Still have no disclosures. So bariatric surgery, it's no secret that it's more than just a weight loss surgery, but the underlying mechanisms from a metabolic standpoint are still being researched. To date, the majority of the research has actually been focused on Roux-en-Y gastric bypass, but as we're seeing similar resolution rates in diabetes and sleeve gastrectomy, this remains an important area to study. Our goal was to further evaluate the LCL-mediated enteroendocrine responses following sleeve gastrectomy. To refresh everyone's memory on the basic sciences, L cells are found in the ileum and colon, and they produce peptide hormones such as GLP-1, PYY, glycyntin, and oxyntomodulin. While GLP-1 has made a prominent debut in the literature, less is known about other peptides that come from the same protein, proglucagon, and these peptides are glycyntin and oxyntomodulin. So we sought out to find out if glycyntin increases postoperatively in the same ways that GLP-1 does. And what do the hormones do? So L cells, again, produce peptide YY as anorexigenic hormone. Glycyntin is thought to have similar actions as glucagon, GLP-1, as well as GLP-2. And oxyntomodulin is also an anorexigenic hormone that is not as well understood. And so these things are thought to not only contribute to the weight loss after sleeve gastrectomy or any sort of bariatric surgery, it's also thought that these peptide hormones have a relationship with diabetes remission postoperatively. So our study, we did a prospective study of patients undergoing sleeve gastrectomy at our institution. We included about 15 patients, and we took the preoperative baseline of their hormone and metabolite responses to a mixed meal. It was a high-protein milkshake at the following time courses. So we drew blood at time 0, had patients ingest the meal, and then we repeated blood draws at time 30 minutes, 60, 90, and 120 minutes. And then we repeated the analysis at 2 weeks. Simply put, we looked at glycyntin, insulin release, as well as insulin sensitivity. And to analyze insulin sensitivity, we looked at 3 different indirect measures, the first being HOMA-IR, and this was a surrogate marker for whole body insulin sensitivity, but we also wanted to see the rates of insulin sensitivity in both adipose tissue as well as skeletal muscle. So to evaluate for adipose tissue, we looked at the rates of decrease in plasma oleic acid, which is a non-esterified fatty acid for adipose tissue, and then skeletal muscle insulin sensitivity was measured by plasma phosphate clearance. So what did we find? So this was a continuation of a project that was started at our institution a few years ago. And initially we saw that GLP-1 increases postoperatively as well as PYY. So again, we wanted to evaluate if glycyntin increased postoperatively similar to GLP-1 since they come from the same protein. And we were able to find that glycyntin indeed increased postoperatively, especially at the 60-minute mark. And again, the asterisks represent numbers that are statistically significant. We also found that insulin release was augmented following surgery. You see preoperatively in blue, and postoperatively there's an augmented response of insulin release that follows a similar curve. And then we thought, well, if there's the augmentation of insulin release following surgery, maybe there's changes in insulin sensitivity as well. So again, we looked at HOMA-IR, which is a marker, a surrogate marker for whole body insulin sensitivity. And from pre and post-operatively, there actually really wasn't a change or statistically significant change in whole body insulin sensitivity. Looking at adipose tissue, you can see pre and post-operatively depicted here. And if you look at the slopes of these lines, they're basically the same. And so there was no difference in insulin sensitivity in adipose tissue following bariatric surgery or sleeve gastrectomy in particular. However, we did see that in skeletal muscle, plasma phosphate clearance decreased more significantly post-operatively, as depicted by the slope of this line here. So it is thought that insulin sensitivity increases in skeletal muscle following sleeve gastrectomy. So what does all this mean? We're still not really sure. We know that sleeve gastrectomy leads to increases in postprandial responses of GLP-1, PYY, and glycyntin. and that insulin release is augmented due to increased L-cell hormone response. However, insulin sensitivity, at least at the 2-week mark postoperatively, is still unclear. So further studies are needed to evaluate these mechanisms. Happy to take any questions.
Are there any questions from the floor?
Well, I was just going to ask, did you look at all the difference on patients who were actually diabetic versus not?
All of these patients included were diabetic.
Were diabetic, okay. Yeah, because with the data of the new Stampede trial, 5-year outcomes, it shows that sleeve gastrectomy does, in fact, help reduce their need for insulin use. So I just wanted to make sure these were, if you'd looked at that or not. So.
Thanks.